What is Botox? What are fillers? Are they the same thing? Hi, I'm Dr. Athre. I'm a double board certified facial plastic surgeon here in Houston, Texas. The focus of this video is to explain what is Botox, what are fillers, what do they do, are they the same, are they different? And I'll even give you some tips on if you're considering these procedures, things that you can do to not look overdone. So let's jump in and see what these products are. So Botox and fillers are not the same thing. Many times I think people use these words interchangeably, very similar to going to a restaurant here in the South and asking for a Coke. Asking for a Coke, you might get a Sprite, you might get a Pepsi, you might get a Dr. Pepper. It's all considered the same. Therefore, let's actually break this down into very, very specific bits. Botox falls into a category of injectable agents called neurotoxins or neuromodulators. There's some other ones here. There's Xeomin, there's Dysport. These are all the same type of chemical. They all work in the same fashion. So how does that work and what do they do? So let's kind of take a little bit of a break and I'm going to explain this very simply. So let's say I want to move this little muscle right here. So we have a nerve that goes from my brain all the way down my neck, out the spinal cord, all the way to this area right here, to the actual muscle. So when my brain sends a signal to squint or do that motion, there's an electrical signal that goes all the way down that nerve, all the way to this area. Now, if you look very specifically, that nerve almost touches the muscle. So just like you have an electrical connection where two wires are soldered together or welded together, in this area, what you have is something called a neuromuscular junction. So here's the nerve, here's the muscle right here, and in response to that electrical signal, this nerve actually releases a little chemical. That chemical goes across this little tiny distance, causes a chemical change in the muscle, which causes the muscle to contract. So that is how that little electrical circuit works. What the neuromodulators do is prevent the release of that chemical. So the signal may be coming from the brain. Signal goes down the nerve, but when it gets down here, there are no more little vesicles that can release that chemical to make the muscle contract. So all of these medications, whether it be Botox, whether it be Xeomin, Daxxify, Dysport, they all work on the same principle. It's kind of like having a chemical and having little tiny chemical changes, and they do different things. For example, let's talk about the difference between Botox and Dysport. Same general chemical, however, Botox takes roughly about a week to take effect. Dysport takes about 3 to 4 days to take effect. Botox lasts for about 3 months. Dysport lasts for about 4 months. So same general chemical, little small chemical changes, but they give slightly different effects. Now, let's compare and contrast that to fillers. So fillers, there's a whole bunch of them. So some of the common ones you probably heard about are Restylane, Restylane Define, Restylane Kiss. Then let's see, there's Juvederm, Juvederm Ultra Plus, Juvederm Voluma. So every one of these things that I have just rattled out right now are hyaluronic acids. What is hyaluronic acid? Hyaluronic acid is a chemical that naturally occurs in your body. So for example, right in my knee, right there is hyaluronic acid inside my knee that allows me to lubricate this joint when I'm moving. That chemical is synthetically prepared in a laboratory, put in a syringe, and we're injecting that into the body. So that is what a filler is. What does it do? Well, there's a lot of videos on here on YouTube where I explain the aging process. And one of the things that I explain as we all age, we lose collagen, elastin, and subsequently volume. So what filler agents do is basically puff out the skin. So it's kind of like adding a little bit more air in a balloon. They're adding volume. So hyaluronic acids are kind of like hair gel, for lack of better words. Kind of feels about the same as hair gel. You put it in a syringe, you're injecting it into certain target areas. They draw water, swell up a little bit like a sponge, and basically hang out for anywhere from 6 months all the way to about 12 to 13, 14 months, depending on 1, the type of filler, and 2, where it's injected. So for example, if you're injecting fillers in the lips, since we talk a lot and move our mouth a lot, those muscles break down the filler at a pretty fast pace. So therefore, fillers don't tend to hang out a whole lot of time in the lip area. On the other hand, if we're injecting into the cheekbone area where there's not a lot of motion, the types of fillers that we're using in that area tend to last a lot longer. Now, there are other types of filling agents. So we've talked about hyaluronic acids. There are other categories as well. So one of those categories is Radiesse. Radiesse is a type of filler agent. It's made of calcium hydroxyapatite, which is basically bones. So you're synthetically making the chemical that is composing bone in the laboratory, grinding it up into a very fine powder and putting it in gel format. This type of filler is a semi-permanent filler. That filler can last anywhere from about 12 all the way up to 16 months. But because of its thickness and its inflammatory condition, it's really used for thicker tissues and not for things like lips. So one key point in this talk is that all fillers cannot be used everywhere. Repeat, all fillers cannot be used everywhere. There are certain fillers that work better in certain areas. So for example, under eye region, Restylane is probably the best filler for this area. All other fillers tend to end up being lumpy, bumpy, more contour irregularities, lots of different issues. So just like that, on the other hand, if you have Radiesse really needs to be used in thick tissues like maybe ML folds, jawline, chin, zygoma, those kinds of areas. Because using it in softer tissues like under eye or in the lips can cause a lot of inflammation, granuloma, scar tissue, and a whole lot of drama. So take home point, all fillers cannot be used everywhere. So now what we've understood is there's basically two categories: neuromodulators, which include Botox, Dysport, Daxxify, and on this hand, you've got filling agents, which are things like Restylane, Juvederm, Radiesse, so on and so forth. So how do we use these things in order to achieve our rejuvenation goals? Let's start first with the neuromodulators. Some key areas that neuromodulators can be used is the glabellar region, the forehead region, and the crow's feet region. These are three common areas where you can use neuromodulator agents. Now, what do they do? So if you remember from the first part of this talk, they stop muscles from working. So there's a muscle around the eye, and this muscle is responsible for the close portion of the eye. And we can selectively make this portion of the muscle stop working, thereby minimizing the crow's feet. This muscle right here is the corrugator procerus complex. It is part of the squint portion or squint function, and we can stop this muscle right here, which prevents the Levin lines. This muscle right in here comes from your entire forehead, is called the frontalis muscle. By stopping this portion of the frontalis muscle, we can stop the horizontal lines. So this is a very brief synopsis of a couple of areas where neuromodulator agents work very well. Now, what are some tips such that you can get a non-done look with neuromodulator agents? If you've never had Botox or Dysport ever before and you're wanting to kind of taste test it, I think it would be very wise to first of all go to a surgeon or dermatologist who's very experienced in Botox and Dysport and start easy. So whenever someone comes to you and says, oh, I can put 60 units and I'm gonna do this, if you've never had it before, my overall practice philosophy is, why don't we try one area, okay? For example, this I think is the easiest area for patients to start off with, and let's see how you like it. If you like it, you enjoy the results, you're happy with the results, then let's keep moving forward. And then we can slowly maybe put a little bit over the forehead to kind of soften the forehead lines, a little bit on the crow's feet to soften the crow's feet lines. I personally like a very soft look. I don't like an over paralyzed look. I don't like the I can't move my face and so I have no facial expression look. I kind of like people to look natural. I want them to be able to give people the evil eye if they need to. So these are kind of my mojo or my philosophy. So in order to not look done, my suggestion is see a surgeon or dermatologist, see the doctor, tell them kind of, hey, this is my first time, start easy, don't go overboard. Now, with respect to fillers, there's a lot more that I can say about fillers. This part of this talk needs to be based on 100% honesty. If you had seen me maybe 12 or 15 years ago, I really was a very big filler proponent. I liked fillers. I thought that the hyaluronic acid fillers really helped replenish volume. Fast forwarding 12, 15 years, looking at long-term results, I am not a big fan of fillers. I feel that there's a lot more toxicity with the fillers than a lot of the providers and the filler companies are willing to let on to the public. And when I say toxicity, this is what I'm talking about. As I'm going through patients' under eye regions in surgery, lower eyelid blepharoplasty, I'm noticing that some of this filler lasts for 6, 7, 8 years. It doesn't just all go away. What was told to us is this is a completely dissolving type of filler that all goes away. More and more, I'm seeing that this is not the case. Furthermore, I do feel that there is a type of filler fatigue where patients are getting filler over and over again. It's not completely breaking down and they're seeing long-term problems with the way that the skin moves. Things like Tyndall effect, which is a thinning of the skin with a bluish hue, all of these various things. So I have transitioned my practice over to fat, which I think is a much more natural type of filling, and it's all your own tissue. If you want to know more about facial fat transfer, please check out the facial fat transfer video right here. Now, however, do I think that there is a place for fillers in the whole facial rejuvenation spectrum? I think that fillers are here to stay. I don't see them going away. And I think that they can be performed safely and judiciously. Tips that I would give you in order to get a good result without looking either overdone, overfilled, or puffy. First of all, I do recommend that you see a surgeon or a dermatologist. There are complications to fillers. Fillers are not just a benign, just throw it in there, call it a day. I think that you really should see a surgeon to do your fillers because of the fact that they are trained not only in doing the filler, but also addressing any of the complications that may arise. In today's world, there's a million med spas that advertise fillers at all sorts of different prices and such, and you might be tempted. But for safety's sake, I do think going to a board-certified surgeon and having them take care of you, you're going to sleep better at night. Next, if it's your first time getting fillers, start easy. I have never in 20 years injected more than 1 cc of filler in a patient during a sitting. So when I see patients in my surgical practice and they're like, oh yeah, I had 5 syringes of Restylane injected, I don't even know how to inject 5 syringes of Restylane. So I think that a little goes a long way. Start easy. Don't just get into this mindset that if a little is good, a lot is better. And one very critical thing that I'm going to warn you against is please don't get addicted. This was just last week. I saw a patient who is overfilled. She has been filled with a permanent filler. It is not removable. It looks atrocious. And when I told her, hey, listen, this is what it is, her first question to me is, so do you think you can put more filler in there and camouflage it? And I'm looking at her and going, no, I can't. So there is a certain portion of this that I do feel that fillers give this very quick pick-me-up, which is very addictive. It's kind of like almost like a cortisol rush, and patients get hooked into this. And that's why there's a very high rate patients going back and getting more filler and more filler, more filler, more filler. So once you understand this, hopefully you'll understand what you can do to keep yourself safe and not ending up with this big puffy pillow look to your cheeks. So I hope this video has been useful. The clear purpose of this video is so that to educate you, first of all, on what is Botox, what are fillers, what do they do, and a few tips to keep you safe and, keep you looking natural. So I'm wishing you the best of luck on your rejuvenation journey. If you have questions, concerns, thoughts, problems, anything, leave them down in the comments section. We will definitely try to get back with you and hopefully answer your questions. If you liked this content, you said, hey, I want to know more. I like seeing this content. It's really difficult making this content, so I definitely would appreciate the subscribe. It tells us what you like, and it gives us some ideas on what we need to work on as we're coming up with new content ideas. So it was a pleasure. Thank you so much for your time. I'm Dr. Athre, Athre Facial Plastics, Houston, Texas.